Terry
town.
Schofield, Medford, New York. I'm here tonight representing Hunger Action Network of New York State. Our mission is to end hunger by addressing the root causes, one of which is poverty. About 6 years ago, we had a rollicking debate about whether or not we should be working on health care. And I was one of the people who said, no, there's plenty of other groups out there working on it. However, we realized that when people face a catastrophic illness, they are very often bankrupted, they lose their job, then they lose their health care, then they lose their home, and very often they fall into poverty and just end up hungry. We seek to stop that. I want to follow up on Mayor Bilbo's question. It's easy when you're working to have health coverage. I happen to be a federal employee. I have great health coverage. I'm very happy with it. However, I look around at some of my friends and neighbors and constituents in my neighborhood who have lost their jobs and lost their health care, and there's nothing out there for them. They're not poor enough for Medicaid, and they can't afford private insurance. I'm particularly worried about preventative care. We know that access to preventative care, and I don't care about a person's documentation status, access to preventative care means we save money in the long run. If we don't have access to preventative care for everybody across the spectrum, that's when you end up straining hospital budgets and straining public budgets because you're doing what should have been taken care of in a doctor's office in an emergency room.
And what is your question, ma'am?
Please detail for us the provisions of the bill that would cover unemployed, indigent, and immigrants regardless of immigration status.
Let me start with unemployed and indigent, and I believe my answer to that is exactly the answer I gave to the gentleman a few minutes ago, and that is expansion of Medicaid eligibility and affordability credits for people who enter the insurance exchange so that they could buy plans, whether they be private plans or public plans. Section 246 of the bill quite specifically says that under no circumstances will any funds in the bill be used to provide health care coverage to undocumented immigrants. That's very clear. That is not an issue. That is not an issue that is in dispute. But the piece of the issue that you just raised that I think is important to focus on is preventive care. Preventive care is absolutely essential to us ultimately driving down health care costs. If people engage in preventive care and wellness practices throughout their life, as they age, they will be healthier, and as they age, they will have more productive lives. And that is exactly what we're hoping for. And so what the bill does is it makes an enormous investment in primary care physicians. It tells to seniors that if they have a so-called wellness or preventive care visit under Medicare, that they can do so without any copay. Right now there's a copay. This is a significant improvement in Medicare. So there are several pieces throughout the bill in which we are making an investment in preventive care. It's one of the keys to driving down costs and reducing the rate at which expenses grow.